Hello, my name is Carla Apollo, and today I'm going to talk about the role and impact of cooperative extension in diabetes education in self-care. Definition: diabetes is one of the most common non-communicable diseases in the world. Globally, it is estimated that 382 million people suffer from diabetes. The exact cause of type 1 diabetes is not yet known. However, several factors have been associated with an increased risk of developing type 2 diabetes, such as a family history of diabetes, being overweight, having an unhealthy diet, physical inactivity, increasing age, high blood pressure, ethnicity, impaired glucose tolerance, history of gestational diabetes, and poor nutrition during pregnancy. Application in nutrition. The collaborative process of diabetes self-management education is a key component in improving the health outcomes and quality of life of people with diabetes. Despite this knowledge, suboptimal diabetes self-management has been identified as one of possible causes of poor outcomes in diabetes care in general practice. Self-management refers to the individual's ability to manage the symptoms, treatment, physical and psychosocial consequences, and lifestyle change inherent in living with a chronic condition.
Hi, I'm Joan London. Managing diabetes can be complicated, even confusing, especially when you're first diagnosed. Working with a certified diabetes educator is really the best way to get the support that you need. Joining us is Christina Macchio, a certified diabetes educator, and Dr. Ann Albright, director of the CDC's Division of Diabetes Translation. Ann, it just seems like it must be kind of overwhelming to a person to first get that diagnosis because you really do have to learn to manage it, right?
It's critical. It's like buying a new device and you need to have some instructions. Otherwise, you're flying in the dark. So getting diabetes self-management education and support is at the heart of good care.
So how do you go about working with patients?
So my goal with patients is to meet them where they are. I learned that very young when I started working in a public hospital. I had 70-year-olds, I had 30-year-olds, I had people of all ages in one room. Some people didn't speak English. So I had to speak food because that was a common language that everyone could get, and I used a lot of visuals. And from there, I really developed an approach to make people start feeling comfortable with this thing that they didn't ask for, but that they felt in better control of after a certain number of classes and workshops with me.
Are you also there to say, yeah, we're going to figure out how to manage this, but you're still going to be able to live your life okay?
Absolutely, you're still a person. You're now a person with diabetes. Diabetes is not who you are.
All right, so this is like kind of the human touch, right? That's so important.
Yes, diabetes is very personal. There are millions of people in the country with diabetes and pre-diabetes, but each with diabetes has to find their journey and to be as successful as possible. And diabetes self-management education is critical to having a enjoyable and full journey with diabetes.
All right, well, I thank you both. So if you want to get more information on diabetes self-management education and find an educator like Christina, log on to cdc.gov/diabetes TV. We'll see you next time. I'm Joan London.
Sponsored by
Pros and cons. Diabetes self-management education and training is collaborative process through which people with or at risk for diabetes gain the knowledge and skills needed to modify behavior and successfully self-manage the disease and its related conditions. This process incorporates the needs, goals, and life experiences of the person with diabetes and is guided by evidence-based strategies. The overall goals and objectives are to support informed decision-making, self-care behaviors, problem-solving, and active collaboration with the healthcare team in order to improve clinical outcomes, health status, and quality of life.
Have you or a family member been diagnosed with diabetes? Do you feel overwhelmed by the information you've received about how to manage your diabetes? Good news! There is a valuable resource available to help you take care of your diabetes. Diabetes Self-Management Education is a program where you will get customized one-on-one training from a diabetes educator. A diabetes educator is a specially trained individual who understands what you are going through and can help you make a plan and put the skills you learn into practice. You also get group support from others who have diabetes. This program will help you learn the skills needed to manage your diabetes and thrive in your life. And as an added bonus, diabetes self-management education is covered by most insurances. Ask your doctor for a referral to Diabetes Self-Management Education today, or visit livingwell.utah.gov to find a diabetes self-management education program near you.
Issue applying Ecuador. The prevalence of diabetes mellitus 2 in 2030, it was the first cause of death in Ecuador. The American Diabetes Association and the Latin American Association of Diabetes have stated that education is a right that has everything diabetic patient and should be part of the treatment in all systems of health, both public and private. This right is currently not fulfilled. It has shown that between 15 to 80% of patients do not know the character chronic diseases, exchange portions of food, self-control, food care, and others. In conclusion, the prevalence of diabetes continues to increase globally and nationally, causing an enormous burden to the individual affected by the diseases, as well as the health care system treating them. Diabetes is not curable, but it is manageable. Through active participation in their own care, individuals with diabetes can dramatically impact the outcome of their diseases. DSM has been shown to be effective in reducing the risk of diabetes-related complications in both type 1 and type 2 diabetes and preventing or delaying the onset of type 2 diabetes in those at risk for developing the disease.
Welcome to Your Health with Joan London, presented by the Centers for Disease Control and Prevention.
Hi, I'm Joan London. Diabetes is a growing epidemic in this country, affecting more than 29 million people. The management of diabetes can be overwhelming to some. I'm joined by Dr. Ann Albright, Director of the CDC's Division of Diabetes Translation, who lives with diabetes every day and has to manage it. What's the hardest part, Ann, of managing diabetes?
Well, I live with diabetes most of my life, and it absolutely takes effort to live with diabetes. You have to pay attention to your food and being active and taking your medications. But everything that you do to manage it is worth it.
Yeah, you really have to kind of embrace the lifestyle, right?
That's right.
But 1 in 3 Americans may develop this some point in their lives. But there are things you can do to lessen your chances of getting type 2 and just to make living with diabetes easier. Walk us through some of those.
In taking care of your diabetes, it really is critical that you are establishing healthy lifestyle habits, eating healthy, certainly getting less sugar and salt, Being active, being physically active, working closely with your healthcare provider. Be sure to take your medicines as prescribed, and certainly check your blood sugar regularly. It's absolutely critical as well that you get diabetes self-management education. That's really the key to learning to live well with diabetes.
And you say everyone needs to know their ABCs. What are those?
Yeah, A1C is a blood test that lets you see how your blood sugar control has been over the last couple months. You also need to get your blood pressure checked. You need to get your cholesterol checked, and certainly stop smoking and never start if you haven't.
So, but really important, you should try to find the support of an educator and a group like the Diabetes Self-Management Education Program, and involve your family as well, right?
Absolutely. You need to be sure your family's involved and that they also get the support that they need.
All right, and thank you so much. It is a team effort, and that does include family and friends. And there are also wonderful diabetes educators and online support groups to help you keep on track. I'm Joan London. Thanks for joining us.
Sponsored by